Today I'm going to be talking about the impact of STIs and, more importantly, HIV of human sexuality. So what is an STI? It's a sexually transmitted infection that is passed from person to person through sexual contact. Two types of STIs are bacterial and curable, and then the other one is viral and incurable. If one were to identify exactly how many cases there were in the US, it would be impossible. People who have an STI do not realize it because it generally is undiagnosed with no early symptoms. It is estimated 20 million people are diagnosed each year, and by the age of 25, 1 out of 2 people will acquire an STI out of either not enough knowledge about protection, thinking it won't happen to them, or communication. And on the graph here, it shows that the age range of people who are infected are around their later teens to their early 30s. Regardless of gender, race, ethnicity, social status, or sexual orientation, anyone can contract an STI. Lesbian and bisexual women may also be at risk due to the factor of one being sexually active with a man transmitting it to their female partner. Women who have had sex with both men and women have more HIV behavioral factors than those of women who have had sex primarily with only men or women. These are just a few helpful tips of preventing an STI. The number one way is, of course, being abstinence. Other helpful tips are selecting partners carefully, getting tested regularly, getting vaccinated, being a good communicator, and avoiding injections and other drugs. A person who has an STI is 2 to 3 times more likely to contract HIV through sexual contact. If HIV is not treated, it can lead to AIDS, which is also known as acquired immunodeficiency syndrome. To this day, there is no effective cure, and once a person is diagnosed with it, they'll have it for life. So what is HIV? HIV stands for Human Immunodeficiency Virus, which attacks the body's immune system. When HIV is untreated, minor infections such as the common cold can be much more severe. And this is a diagram of how HIV will attack its host. So the HIV will enter the T cell. Inside of that T cell, the HIV copies itself inside the host and then will end up destroying the host altogether. There are 3 stages of HIV, and each of them have different symptoms. The first stage is called acute HIV infection. In this stage, 2/3 of people will have flu-like symptoms. It is the human's body's natural response to the infection. The second stage is called clinical latency. The virus will continue to multiply, and without treatment, people can last at this stage for 10 to 15 years, whereas others may move through it much faster. The last and final stage of HIV is AIDS, where if HIV is not tested, eventually the virus will take over the body's immune system. Symptoms include sores in the mouth, anus, and genital area, pneumonia, memory loss, depression, and other neurological disorders. The highest sexual risk of transmitting HIV is having unprotected anal or vaginal sex with someone who has HIV. The person on the receiving end is at a higher risk as well when we're performing anal intercourse. Cuts and sores on or around the genital area allow HIV to spread to one another. Other sexual factors can include oral sex, kissing, and sharing of sex toys. Substance use and injections of drugs is a non-sexual form of transmitting HIV and the second most common form. Sharing of needles is a high risk because it is injected into the bloodline. Drinking, smoking, alcohol, cocaine, and methamphetamine can be associated with HIV. Each will affect the user's mind differently and can lead to less frequent use of condoms or protection, along with an increase of sexual partners. A person who is HIV or AIDS positive doesn't mean they're any different from anyone else. They just require needs just as anyone else would, and just a few more. Endless amounts of support groups, treatment centers are available for people with and without the virus. Talking, listening, learning, and supporting one another can help people understand and letting others know that they're not alone.